Parkinson's disease estimated that over 10 million people live with the condition. The number is believed to be higher, given that some cases remain undetected. Parkinson's disease is a condition that results from progressive damage to a specific part of the brain called the substantia nigra. It occurs when dopamine-producing neurons slowly die out. Dopamine is an important chemical that is involved in the transmission of messages between the brain and the muscles. People suffering from Parkinson's will therefore gradually lose their motor skills in a small or large part of the body. Number 1. Tremor. It is quite normal to have a slight tremor in the muscles after a workout. If it happens involuntarily when you are relaxing, it could be a signal about the onset of Parkinson's disease. The brain coordinates voluntary muscle movements. Involuntary tremors that occur on a specific part of the body such as chin, lips or limbs could be a sign that the brain cells responsible for moving the specific part are not working properly. The tremors will usually become more severe as the disease progresses. Number 2. Trouble sleeping. Tossing and turning on the bed while you sleep is a normal thing when you want to change position to get better sleep. It is a way for the body to remain comfortable while resting. However, if the tossing and turning involves sudden involuntary movement which can involve throwing punches and kicks, or even find yourself on the floor, it's a possible sign of Parkinson's disease. Number 3. Rigidity. Rigidity refers to a tightness or stiffness of the limbs or torso. Rigidity, especially in the early stages of the disease, may be wrongly attributed to arthritis or orthopedic problems, such as a rotator cuff injury. Number 4. Soft speaking. It is considered courteous not to shout at people when talking to them. But what if people are continuously asking you to speak louder? You might think that they are not hearing you well although you are speaking in your normal tone. However, if you have been told that you are not audible enough of late and do not have the flu or other throat issues, it is possible that you are developing PD. Number 5. Melanoma. Individuals with Parkinson's disease may have an increased risk of melanoma, a serious type of skin cancer. As a result, people with Parkinson's disease should undergo annual skin examinations with a dermatologist. If you notice any troubling skin lesions, be sure to talk to your physician about them. Number 6. Masked face. This is characterized by having a blank, seemingly serious stare. The face tells a lot about emotional response. PD patients are often described as having a flat expression on their face even if they don't realize it. If people point this out about you often, it is possible that the brain cells that control your facial muscles are impaired. However, a masked face can also result from side effects of drugs or even cosmetic treatments. Number 7. Urinary issues. Urinary frequency and urinary urgency are other possible symptoms. Urinary problems may be worse at night when a person is lying flat. There may also be problems with initiating a urine stream, slowness of urination, and overfill of the bladder. Number 8. Lightheadedness. Separate from the balance problems of postural instability but contributing to gait problems, lightheadedness or a faint feeling occurs often with Parkinson's. This symptom is related to the body's inability to quickly regulate blood pressure, particularly when sitting up from a lying position or standing from a sitting position. When severe, lightheadedness may cause blackouts or fainting. Number 9. Rigid body movement. Feeling rigid after waking up is quite normal as you age. However, your body should get into the fluid rhythm after a few minutes. However, if the rigidity persists into the day such that you have trouble walking or moving your hands, you may have Parkinson's disease. This rigidness occurs when the brain cells that control body movements are damaged. The condition may worsen as the disease progresses. Patients will usually get slower, and in severe cases, movement ceases completely. Number 10. Weight loss. Loss of weight is a common symptom, particularly in the later stages of the illness. If weight loss is significant and unintended, your physician should perform an examination to exclude other medical causes of weight loss.